I know this is going to be a controversial one, but I am not a big fan of Prenuvo. And I put them in the same box as places like HerScan. So there's a few reasons for this. First, for reason number one, they're very fear-mongering. So I don't like fear-mongering. I don't like scaring people out of their money, and I feel these companies do that. If HerScan in particular, they try to scare people away from mammograms, which is the gold standard for breast cancer screening. So I don't like that. The second reason I don't like it is because they remove you from the doctor-patient relationship. They have a relationship with you, and if there's any trouble, you getting help from a physician is often complicated. And you can look online. I've had many patients that have had great difficulty getting help when abnormalities were found on their screening. And just to be clear, I'm a big advocate for proper screening. I just want you to have help. So if something is found, you have someone who is there as your advocate to get the right thing done. So let's talk about Prenuvo in particular. So I think it's important to understand that all MRIs are not created equal. And we're looking at different things with different types of MRIs. And what we order as clinicians is really dependent on you as the patient, what we're concerned about, and what exactly we're looking for. They don't take that into consideration at Prenuvo. So they do like a full body MRI without contrast. So depending on what your history is and what your potential risks are for different medical problems, that may not be the right screening test for you. But it gives people this false sense of security because they had a full body MRI. It's the best test in the world, yay! But it's really not, and it's not for certain types of things that we're looking for. It's really important, again, that you have the right test to look for the right thing. Now here's the other issue, is that there is a lot of discussion in the medical community about the quality of the reads that patients are getting on these tests, that the radiologists reading them are not necessarily experts in all of the particular areas that they're looking at, and that can be concerning. There's a lawsuit I'm sure everyone's seen of a person that is suing Prenuvo because something was missed on one of his scans. Now, it's of course plaintiff's attorneys still just releasing information, but I think it's an important concern. The other problem I see, and this is Prenuvo and HerScan, is that people with issues are going there instead of just going for screening. And these places are just not set up for that. And it's problematic. I had a patient go to HerScan with a concern, and they told her she had ruptured implants. They didn't identify, the patient had literally had a mastectomy and had mesh around implants. There was no rupture at all. They didn't know what they were looking at. They should absolutely not be looking at a patient with a concern. And the same thing is true with Prenuvo. But unfortunately, patients do go there occasionally, and it's concerning. I don't love self-service medical care because access to information does not mean automatic expertise. I want patients to have high quality care, and I want experts leading their care so that they get the best possible outcomes. And like I said, it's very important that you get the right tests, not just the test that place sells. A lot of these things are outside of insurance when insurance would have covered tests. And I want your doctor to help you if something's found. Now, I completely understand the issues with healthcare. Access is a problem. People don't have health insurance. This is the best they can do. Whole nother video. But in general, I don't like the place.